Very good afternoon, respected chairperson, dear colleagues and friends. I am Dr. Jayakumary from College of Medicine of Gulf Medical University, Ajman, United Arab Emirates. I'll be presenting the study titled The Role of Hypertension on Urine Biochemical Variation in Urinary Stone Patients. As we know that the urinary stone disease is a major public health issue across the globe, with the prevalence of this can vary globally. That is from 7 to 13% in North America, 5 to 9% in the Europe, and 1 to 5% in Asian countries. So it can affect hypertensive patients disproportionately as compared to the normotensive subjects. And not only that, this is commonly seen among the diabetes and the obese population. So the hypercalciuria is the most frequent risk factor for renal stones, and some studies have reported calcium metabolism disorders in both patients and the animals with hypertension, including a higher calcium excretion rate. Epidemiological surveys have found a significant correlation between arterial blood pressure and calcium excretion. So with this preamble, this study was conducted to compare the levels of urine biochemical parameters in urinary stone patients with different levels of blood pressure. So this is a retrospective case record study conducted in the urolithiasis clinic in Trivandrum, Kerala, India, and we collected around 24-hour urine sample from patients. Around 1,112 urinary stone patients were included, and the parameters like blood pressure, socio-demographic features, hematuria, infection, etc. were collected as part of this study. And the urine biochemical parameters were included in the study are the uric acid, calcium, phosphate, oxalate, and magnesium. So coming to the result, the association between stone patients with level of hypertension and gender, that shows that here you can see the male patients, and the hypertension was categorized into normal, elevated, hypertension stage 1 and stage 2 according to JNC classification. And among male, majority, that is 36.5% were in the stage 1 category, and 28.7% were in the stage 2, and only 31% were in the normal category. With regard to females, 28.1% were in the stage 1 category of hypertension and 21.7% in the stage 2. And there was a statistically significant association observed between the gender and the levels of hypertension. So this table shows the association between stone patients with different levels of hypertension and the age group. So here you can see less than 30, the age was categorized into less than 30, 30 to 50 and greater than 50. And the hypertension, the blood pressure level, normal, elevated, stage 1, stage 2. And then here 45.2%, that means majority, that is 55% were hypertensives. So, and among them 35.9% in the less than 30 years of age group were in stage 1 and 12.5% in the stage 2. And if you see in 30 to 50 years of age group, 30%, so here it was 55% in the elevated level, and here it is 70% in the elevated level. So that means 36% in stage 1 and 30% in stage 2 level. And now going on to the greater than 50 years of age category, and 75% were having elevated blood pressure level. So that is 42.9% in stage 2 and 30% in stage 1. So 55, 70 and 75. So as age increases, there is a chance for increase in the level of hypertension, and which was statistically significant. So this table shows the association between stone patients with the level of different level of hypertension and hematuria, presence of hematuria. So here the hematuria was present. 34.8% of the patients with normal hypertension had hematuria, whereas 65% of them were in the elevated level of blood pressure. So in that 35.3 in stage 1 and 26% in stage 2. But this was more or less similar in both, all the present or absent was more or less similar in all the different levels of the hypertensives. So that was not statistically significant. And this table shows the association between the stone patients with different levels of hypertension with infection, presence of infection. And this was also like more or less similar in the stage 1 or stage 2, it was present more or less similar. So, and that was also not statistically significant. So, this table shows the mean and standard deviation of urine uric acid, oxalate, magnesium and its statistical significance. And here you can see there is the mean level of the uric acid increased as the level of the hypertension goes. Like, it was more in case of stage 1 and stage 2, and this was statistically significant. And with regard to oxalate also, in the stage 2 level, it was the mean value was higher and which was statistically significant. And magnesium level, if you say in the stage 1 and stage 2 levels of hypertension, the mean values of magnesium were showed a statistically different level. So, this table shows the mean and standard deviation of the urine creatinine, calcium, sodium and potassium and its statistical significance. None of the variables were statistically significant. And coming to the discussion, the studies have shown that a large proportion of patients with high blood pressure have greater risk of developing urinary stone disease. And this can be attributed to increase in oxaluria, calciuria or increased saturation of calcium oxalate and uric acid. In this study also, a significant difference was observed in the level of uric acid, oxalate and magnesium. So, the studies reported that the rate of urolithiasis increased from 1.1 in the lower blood pressure class to 13.3% in the upper one. And the pathogenic link between hypertension and the stone disease is not fully understood. So, to conclude, significant difference was observed in urine values, namely the uric acid, oxalate and magnesium between patients with normal blood pressure and varying stages of hypertension. So, the significance of this paper is that it is important to monitor the blood pressure level periodically to prevent the occurrence of urolithiasis. Both hypertension and stones might be addressed through lifestyle modification to prevent weight gain, which can be an attributor. So, adoption of lower sodium diet with increased fruits and vegetables and low fat dairy products may be useful to prevent both stones and hypertension. So, with this, I end my presentation. Thank you so much.